Hi, everyone. I'm Dr. Kanupriya Agarwal, and that's my team. And we're Team Dr.bot. Let me get a show of hands here. Has anyone ever has a loved one who was ever diagnosed with cancer? Whoa, that's a large number. I'm sorry to hear. Okay, let's see. So there are 210,000 cancer misdiagnoses annually. 88% of second opinions refine treatment plans, and 22% of them completely change the plans. Now, imagine if we have almost $200,000 of cost savings with having just an appointment adherent patient using a second opinion. But there's less than 50% of cancer patients who get a second opinion. And why is that? I'll tell you. As a cancer patient, I'm afraid that my cancer will progress over time. I'm afraid if my insurance will cover it. And I'm afraid of insulting my oncologist. So I don't seek a second opinion. But we've built a solution for that. And that is an AI conversation bot, which is based on smart triaging and provides second opinion provider matching, which mitigates all the three problems because I don't interact with my oncologist, so there is no insult. It checks for insurance compatibility, and it also reduces the time until second opinion. In addition, it also provides pre- and post-appointment reminders and transportations, thereby eliminating no-shows. Now, the smart triaging is based on a three-tier system which categorizes patients and assigns them to appropriate providers based on the disease stage. And what does it do for us? Let's see the demo of what we've built. So here is a Facebook Messenger-based chatbot. It interacts with the patients. It shows them the consent. The patient agrees to the consent and starts chatting. The patient tells the bot that she's just been diagnosed with breast cancer. The bot is very human and empathetic and wants to help the patient and asks them questions like, has she been on treatment, and what is the preferences, like zip code and insurance provider, and based on the answers, it matches the patient to the appropriate set of providers. Now on the list, she chooses a provider and calls the provider's office to make an appointment. Now after that, the bot will confirm, has she actually made an appointment? Following that, the bot will actually help her schedule the transport, which actually helps with actually keeping up the appointment. So let's see what this actually does for us. This helps with increasing appointment adherence, which ties into the value-based model. And it also helps with decreasing unnecessary procedures, which optimizes care pathways. Now, this overall improved patient experience increases HCAHPS scores for the hospitals. And now with your support and our matching contribution, we can bring this idea into a reality using a 5-point plan. And now I'm happy to take any questions. Thank you.
I don't really have a question. I think it's a good idea that you added the transportation to it.
Thank you.
In your presentation, I think I heard at one point that at the beginning that you commented about the concern of insulting your oncologist, that the initial oncologist wouldn't have to be aware of the consult. Can you speak a little bit to the pros and cons of that, actually?
Sure. So what happens is a lot of times the patients are afraid that they might they feel a little hesitant or apprehensive that if whether or not they should seek advice or seek out the second opinion through their primary oncologist. So they just don't, and because of that they end up with a misdiagnosis or an unoptimized treatment plan. And using our platform, that can be averted or modified. And I think I think because of that, second opinions are really important, and because of that, the morbidity rate can come down greatly. So I think insulting the oncologist is more. It's a little harsher term, but I think it's more about respecting, one's individual level of choice, I guess.
And then the coordination of care issues, absolutely. Something
That's
to
what I
think
was
about.
really asking
Right,
about. So
because-
how does the individual know or decide that the first physician that they saw is right or wrong, or the second is right or wrong, and integrate the two? Because they arguably may neither be right nor wrong, but that something in between is the best approach. It would seem that that'd be confusing for many patients, particularly if there was substantially different opinions between the two. So how would you handle that kind of a
Sure.
situation?
So, for example, if a patient has been on treatment from the first provider and has not seen improvement or has worsened within a substantially short period of time and has started developing suspicion over treatment or with the diagnosis, or just even not been able to develop that rapport with the doctor, and or is uncomfortable with the doctor, wants to seek out a second opinion for one of these or any other reasons. So that would be a good base starting point.
And then I'm sure they can also, if there is such a stark difference between the two opinions, then they can definitely talk to whichever oncologist they have better rapport with to then think about what is the best way forward.
Thank you.
Thank you.
Thank you.